Hello, I am Dr. Pramod Kumar Gupta. I am a senior consultant at Raj Hospital and Vardhan Hospital. I'll be speaking on hypertension. Hypertension, as we all know, that it is a silent killer, so-called it is a silent killer disease in all over the world. As per WHO, nearly 60% of the total deaths in India are due to non-communicable disease, of which 27% are attributed to CVD, which affects 45% people in the age of 40 to 69 years of age. Raised blood pressure is among the most important risk factor for CVDs. Moreover, it remains poorly controlled due to the low awareness about hypertension, lack of appropriate care, so primary care, and poor follow-up. So hypertension is mostly ignored by the persons, and when they usually come to the doctors when they get headache, vomiting, nausea, or vertigo. Then only they approach to the doctor. And examination, we find that the BP is on the higher side. And now it is quite common that we see that nowadays the hypertension is very much common in the younger age group also. So if the normal range for the blood pressure monitoring is 120 by 80, if the BP exceeds 130 by 90, it is just supposed to be a borderline hypertension. It is to be considered as that, and it should be treated with the minimal guidelines of low salt, and if at all symptoms are there of hypertension, then we can start with any drug which is just commonly used amlodipine or beta blockers to start with. If the BP exceeds to more than 139 and above 90, it is just supposed to be considered to be a hypertensive patient, and that patient should not be ignored, and they are advised to treatment. And treatment should be regulated regularly, and the treatment for the blood pressure should be started after the monitoring of minimum 3 consequent BP readings, and then we should start the treatment. International Society of Hypertension has released the ISS 2020 Global Hypertension Practice Guidelines. The inclusion of the optimal essential treatment paradigm attempts to address the issue that the resource poor setting. Optimal care really refers to the evidence-based standard care of, and whereas essential standard refer to the minimum standard of care of allow specification of the essential standard of care of low resources setting. AHA and ACC has released a scientific statement in 2021 offering new guidance for the management of stage 1 hypertension among the patient with low ASCVD risk, among low risk adult with stage 1 hypertension, that is the BP measures in 130 to 139 systolic and 80 to 89 diastolic, and the management starts with the non-pharmacological therapy. That's what I told you earlier also. If the blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy definitely to these patients. Recent studies have appeared in the Journal of the American College of Cardiology, reports that the metoprolol can reduce the lung inflammation and improve the respiratory function in people with COVID-induced ARDS. Lowering systolic blood pressure target down to 110 to less than 130 range substantially reduce severe adverse events in step randomized trial, affirming the sprint finding for the older Chinese population. Among some 8,500 patients aged between 60 to 80 in China, the intensive target trimmed to 26% of the composite CV risk. Finding from now a second major trial supporting a lower target could unite guidelines with even US professional societies range from threshold to 130 to 150. And so in other countries also they consider BP, if it is 130 to 150 systolic, should be considered as a moderate level of hypertension. Most patients with the hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guideline equally recommends 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of the combination treatment is particularly highlighted to improve adherence to the therapy and the BP control. Therefore, the 2018 European guideline recommend, especially in context of lower BP target, to start antihypertensive therapy and the initial dual fixed dose combination of ACE1 or ARBs plus CCB or diuretic. So, according to the level of BP reading, we start this conventional treatment out of any of the things suitable to the patient, is seeing to the age and his other profile and other comorbid conditions. Hypertension is mostly we seen associated with diabetes also. When the blood pressure is associated with the diabetes, the parameter is further declined. Say in diabetes, the blood pressure level management should be less than 120/80 to this level. That protects the liver and the kidneys also in diabetes patients. Therefore, since early in July 2018, products containing valsartan have also been recalled worldwide. The reason is the detection of the known carcinogen, namely N-nitrosodium methylalanine, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. And valsartan and NDMA has also been classified by WHO International Agency for the Research of Cancer to be carcinogenic in humans. If 1 lakh patient would have received NDMA contaminated valsartan from the countries from where it is being imported, they every day for 6 years, the highest dose, it could result in 22% additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patient if they had taken the highest daily dose of over 4 years. Valsartan recalls accompanied by significant increase in the rates of emergency events. So, in nutshell, hypertension should be well controlled to every patient. Thank you very much for kind listening. Thank you.